really forget, you forget how dull the colors were
Sure.
until you have this done.
Yeah.
Because they're extremely bright.
Yeah.
That's the only way I can describe it. They're almost maybe like somebody that would be colorblind, let's say.
Yeah.
And then they do some kind of surgery where they can see again.
Sure.
And that's what that reminds me of,
Thank you so much, Candy, for joining us and sharing your story. I know you've been a patient of ours for quite some time now, and we've been monitoring the cataracts for a while, and finally over the last couple months they kind of got to a point where you're ready to say, okay, they were causing some issues, right? What were the issues that you were experiencing with your cataracts?
Oh, good Lord. Very dull sight. It wasn't clear. It wasn't sharp. It wasn't bright. At night, I couldn't drive at all anymore.
Yeah.
I would see halos, like these round halos that you see.
Yeah.
And I just didn't feel comfortable anymore. And reading, forget it. I mean, I had to have glasses.
Sure, sure. And now we're about 2 months or so out from surgery, just a little less. And how do you feel about your vision?
150% better.
Yeah.
150%. The colors, just everything. It's almost like when, you were a kid.
Yeah.
It's great. They're wonderful. They're just wonderful.
Kind of leading up to the process, I know that cataract surgery and picking lenses, and it can be really overwhelming because there is a lot of information. How did you kind of deal with that and come to the decision that, you know what, I think maybe the light adjustable lens is a good choice for me?
Well, when I found out that my girlfriend actually had this done not too long ago, not these lenses, she had other lenses.
Sure.
And so we were talking about it, and I asked her, I said, well, did you go back in, for these adjustments? And she didn't know what I was talking about.
Yeah.
And she had just regular lenses put in that you all use.
Sure.
She's not that happy with them, to tell you the truth, because they didn't do any kind of adjustment at all. So what she sees is what she gets.
Right. Right.
And with these, due to the fact I've been coming back to have them adjusted, to be honest, I was not happy at the very beginning because it was only 2 days.
Yeah.
And nobody really told me. I couldn't see anything. It was nothing but fog.
Sure. Sure.
And it was just like overnight that it just cleared up.
Yeah.
And they're great. They're really, really great.
Yeah. You're here for your last lock-in treatment.
Yes, sir.
And so, the light adjustable technology has been a real game changer, right? Because this is the first time in our, history of ophthalmic surgery where we're actually able to get patients exactly to where they want to be, not where we think they want to be, right? Exactly. How has, the process been with wearing the glasses?
Well, you mean these glasses?
So
it's like having sunglasses. I mean, it's really no big deal.
And that's the biggest caveat, right? With the light adjustable lenses is, you got to wear the sunglasses. You got to make sure that they don't, that they don't alter the prescription of the lenses.
But, I mean, most people in Florida, at least as far as I know, they wear sunglasses anyway.
Yeah.
So it just wasn't that big of a deal for me. When you have cataracts, as you know, it's a dull color. You can see okay, but it's very dull. And when you have this procedure done, it's just bright, very pronounced.
Sure.
And reading the same way. I mean, everything. You can just see like you did when you were in your 20s, right?
The surgical process, how did you feel during that? Pretty quick?
It was very fast. Very, very fast. Extremely fast. And
then during the healing process, I know we mentioned a few days of kind of some blurry vision, maybe a little bit of glaring or halos. That was it.
The 2 days I had that, and it really wasn't that. It was just foggy. That's how I can describe it. It was foggy looking. And then after the second day, the third day, when I got up, I mean, I could see. I think
one of the things that we talked about was really fitting the lens with the patient, right? And I think that that's a really important thing. But, what really led you to say, okay, you know what, I do think that this technology is good for me?
Well, because they can be adjusted to what you want. You can, if you don't want to read 3 feet out in front of you and you'd rather read closer up, they can be adjusted so you can do that. That's one of the things that's really good.
You've gotten an amazing result. I can't
believe my God, it's unbelievable. It's night and day. I mean, you've heard that expression? It's night and day.
You're seeing better than 20/20 for the
100%.
distance, and
it's unreal.
Your near vision. When was the last time you've probably picked up some readers? It's been a little bit now,
it's been a long time. Long time.
I really appreciate you letting me take care of you and placing your trust in me.
It's night and day, really. It's night and day. And the surgery itself, it's no big deal. It's over like really fast.
That's awesome.
Really fast.
Well, I'm so glad you had an amazing experience.
Thank you.
Thank you for sharing your story.
You're very welcome.